and present something which is very close to my heart, and that is the history of madness or insanity or psychosis. I've been working as a psychiatrist more than 30 years, and in my opinion, this topic has not been really especially very well studied. I mean, in terms of psychosis in the perspective of let's say, different cultures. So my next one, please. Next slide. Yes, thank you. I would really talk about maybe few topics, mainly about history of Islamic or Arabic medicine, focus on classification of Junūn, which means madness or insanity or psychosis in modern language, and of course compare that with current and previous European and let's say classifications of psychotic disorders or madness in the world. Next one, please. Next one, please. Yeah, so the history of medicine has started many millennia ago in Mesopotamia, a country which is mainly focused now around Iraq. And it's really important to know that medicine, for the first time in the world, about 2,000 years before Christ, became as a established profession in Mesopotamia by Babylonians. And the Code of Hammurabi is one of the earliest really code of medical practice, which really is focusing on profession of medical science and what's expected from a medical really professional. The history of ancient medicine is really also very, very rich, and the medicine was practiced there by physicians, priest physicians, and Egyptians. Ancient Egyptians had really significant knowledge about a variety of medical fields. As far as ancient Persia is concerned, the roots of medicine goes back to a city in current Afghanistan, Balkh, where Zoroaster, the Prophet Zoroaster, was living, and some say that he was born there about 600 years before Christ. There, the medicine was also quite established, and there were at least two groups of physicians, one who were called Drustbad, who were dealing with preventive medicine, and the other ones were called Tanbezeshk, or of body physician, who were practicing clinical medicine. And in terms of therapy, they used almost three forms of therapeutic methods. They used herbs, like a pharmacotherapy. They said they used knives, which in modern language is surgery, and of course they used words, which is psychotherapy. Here, there as well, they had the Zoroaster code of medical practice as well, and it's very interesting to read that the code of practice there is expecting that the physician has to be experienced and skilled, but also somebody who's got a feeling, is a sweet tongue, has good communication skills, is gentle, and of course mainly is acting with integrity. One of the most important really milestones, if I might say, in pre-Islamic medicine is the Junūn, the beautiful garden, which is located in current Iran. And here, about 300, about in the year of about 300, the prison was founded by Sasanian King Shapur. And later, about 529 AD, this Junūn it was a big city, and it was there was built a hospital which was founded by a very famous king, Anushirwan the Just. As the Greek-Roman Empire was really collapsing, a lot of Nestorians and Greek and other physicians moved from there to Junūn. Next one, please. What happened then with the fall of Persian Empire in 641 and the rise of the Abbasid Empire, the capital Baghdad was built on the ruins of previous Persian Empire capital, Ctesiphon. Baghdad was built there. And it's really quite interesting that Al-Mansur, the king, suffered from abdominal problem, and he called one of the famous, it was the medical director of the Junūn hospital, an historian doctor, it was called Bakhtiyeshu, Jirjis, son of Bakhtiyeshu. Following that, the king recalled most of the physicians and scientists from Junūn to Baghdad, where he built a very famous, what we call Baytul Hikmah, which means the house of wisdom, and he started a translation movement where they started to translate important books from Greek, from Indian language and other languages into Arabic. It's really important to say that between the 8th and 12th centuries, medicine and science in general became really reached his peak, if I may say, and famous physicians and scientists were born in the Islamic world. And cities like Balkh, Ghazni, Herat, Nishapur, Ray, Samarkand, Baghdad, and those cities really had all hospitals and centers of education. Sadly, with the born of Genghis Khan and Mongolian Empire, the Islamic world was almost destroyed, and in 1221, Genghis Khan damaged or really destroyed one of the first big cities in the Islamic world, which was Balkh. And with the destruction of Baghdad by Genghis Khan's grandson, Uligu, sadly, the Islamic era, the golden age of Islam, was really terminated. Next, please. Next week, please. So now, if you think about the objective of this work, really is to look at the Arabic-Islamic perspectives on madness, if I may say, or Junūn, or insanity, and compare them very briefly with classical Greek-Roman views, with early European schools, mainly English, French, and German schools, and international classifications. Next, please. For the study, we had access to one of the most important, really textbooks written in Arabic as well as in Persian. So the most famous was Firdaus al-Hikmah, which is the Paradise of Wisdom, first medical textbook, written in 1848 by Tabari, a gentleman from today's Turkmenistan, but also included very important books of Rasis, Avicenna, the famous physician and philosopher, coming of medicine, and so on. Next, please. Next, please. Yes, thank you. So in general, it's very interesting, really fascinating to see that that Junūn or madness was really classified at least in three, four categories. First of all, the Araz, Tablet and Abraz, it was meaning organic or symptomatic psychotic disorders. Then they are talking about permanent or long-standing mental disorders or madnesses, and then reactive in other. Next, please. Interestingly, when they talk about the symptomatic mental disorders, they talk about at least 6 different conditions: اختلاط التخيل, corruption of imagination, corruption of thought, and of course, corruption of mind, also Junūn or madness. They also talked about conditions like Sobara, Sokrat or mutism, and of course, alcohol-induced psychotic disorder. Next one, please. Yes, so in terms of the corruption of imagination, it is absolutely fascinating to see that exactly the definition of perceptual disorder or hallucination is that the person's really perception is intact, impaired, but their thinking or fahm, they say, is correct. And they're talking about a variety of different perceptual abnormalities, including visual, auditory hallucinations, as well as tactile hallucinations. And this condition is quite often linked with the impairment of center of imagination, which they thought it was frontal lobe and middle brain ventricle. This is really corresponding with what we call in ICD-10 organic hallucinosis or hallucinatory disorder. When they talk about اختلاط الفكر or the corruption of thought, again, the interesting definition is that the person's perception is absolutely fine, intact, but the thought is really damaged, which means that a person acts really very inappropriately and does things that is really not making sense. And there's a beautiful example from Razi. He says that like a man who closes the door behind himself and throws everything he finds from his room, for example. It's interesting that they link that with the damage of central parts, central and frontal parts of the brain. This condition could be considered something like an ICD as an organic delusional disorder. In terms of the corruption of mind, which is also called Junūn, this is a profound psychotic disorder. Again, it is with the damage of brain as a cause of the condition, but the clinical presentation is extremely complex and really rich, and the person is having a variety of different psychotic symptoms, including hallucinations, but mainly delusional beliefs, including parallel delusions, but also delusions of metamorphosis. Next one, please. Yeah, Sokrat or mutism is very interesting as well. It was mentioned by Tabari, as I said, for the author of the first medical textbook in Arabic, and it is really linked with temporal lobe damage, and this syndrome is really very likely corresponding to F068, the syndrome of organic mutism, due to brain damage or dysfunction. Sobara is a very interesting condition, Arabic word, and it is a form of organic psychotic disorder, maybe something like delirium, but very excited and very when the person is very disorganized and distressed. And of course, it is really always linked with primary brain disorders like sarsam, meningitis, or encephalitis, or with pleurisy or any other physical health problems like fevers or infectious diseases as well. And in terms of alcohol-induced psychosis, interesting is that alcohol has been considered at that time by those physicians as a let's say positive, and they allowed to use alcohol for I think moderate drinking. However, they also knew that alcohol has significant consequences, especially leading to psychotic disorder, including typical perceptual as well as thought disorder, but also a change of personality and so on. Next one, please. Thank you. In terms of permanent insanities, again, there's a lot of other conditions, but I think the most important thing is that the permanent insanities, or Junūn Sabit, are really conditions of multifactorial etiology, including physical, which is about biological, of course, reasons, non-physical, which is mostly psychological elements, and including excessive emotions and so on, as well as environmental factors. So they talk about a number of conditions, especially for me, it's very interesting to hear about isolation in the wilderness with animals, and then mania, which is taken from Greek terminology. But I think a first medical textbook doesn't really call mania at all, but talks about Junūn al-Halij, which we can discuss, ferocious mania, madness or mania. And Qutrub, which is dragonfly, agitated madness, and Dal Kalb, something like mixed psychotic disorder. Next one. This is really the التوحش في البراري مع وحش, the isolation in the wilderness with animals, is something which very likely corresponds to maybe simple schizophrenia, when a person is really significantly isolating themselves from society, and they also have a number of other let's say psychological difficulties, including anxiety, agitation, and so on, as well as really hallucinatory and delusional beliefs. And in a nutshell, that could be similar to what we see today in people with simple schizophrenia, when they just really isolate themselves and live in the wilderness, even in the 21st century, and really do not like being with people and so. Next one, please. Mania, as I said, it was in the first textbook is not mentioned at all, but the following textbooks and all famous physicians like Avicenna and Majusi and Razi and so on, they talk about mania, and quite often they mention Greek physicians. And they are calling mania as one of the most severe forms of madness. And Avicenna talks about two forms of mania. Sobari, which is agitated, it's psychotic mania, and Hari, which is rather inhibited mania. Interestingly, mania was considered by Savage one of the first French physicians as a universal madness with aggression. And we know very well that Pinel, in his famous book on manias, talked about manie sans délire, mania without delusions, and manie avec délire, which is mania with delusions, which is quite interesting. Next, please. Qutrub or dragonfly, a very interesting condition. I've never seen similar condition mentioned in any Western or European books. The only thing which reminds me a little bit is lycanthropy, but I don't think lycanthropy is similar to this. But anyway, Qutrub, they define it as a very agitated form of psychotic disorder. It is believed that it's really hereditary and treatment resistant, and occurring mostly in winter. And of course, the presentation is that the person is agitated, restless, disorganized, and wandering from night to dawn, especially in cemeteries. Next, please. And that's another interesting condition in Arabic and Islamic psychiatric, let's say, textbooks, if I may say, the al-kalb, or dog's disease. Very, really interesting. And this is something which we might say today as a kind of maybe schizoaffective disorder or something like that. And although Avicenna and Giugiani talked about this condition as a form of mania, but other people, other physicians call it as a distinctive entity of clinical illness, if I may say. The interesting thing is that they believe that this condition is mimicking behavior of a dog, if I may say, at times quite friendly, and so, but on other occasions extremely hostile and aggressive. So that is something that is very unique for these days to mention that. However, in the European if you look at the European old textbooks here, I think we can see that there are similar conditions mentioned by other famous psychiatrists like Pinel, who was talking about periodic mania, periodic, for example, and also other people, other physicians talk about la folie, double form, and of course, folie circular, for example, circular insanity, for example, and so on. Next, please. Then, in terms of reactive psychotic disorders, very interesting. There's at least a few conditions, and one of them is called Homayun Shahpesandy, maybe fever from enchantment. However, it is a psychotic disorder. Homayun or love is another form of the conditions they talk about, and of course, Rija or delusion of pregnancy. Next, please. Yeah. As far as the fever from enchantment is concerned, it is believed to be resulting from magic, if I may say, and the person is described as a person who is losing his mind and is often quite thirsty. Very unique language, of course. So I think if you look at the ICD, you might say that it is something similar to a psychogenic paranoid psychosis. Next, please. In terms of the love madness is beautifully portrayed by Avicenna. Depending on really, in my opinion, reading those textbooks, depending on really clinical severity of the condition, maybe mild, moderate forms could be considered as a form of, let's say, somatoform disorder, but severe forms really mimic psychotic disorder. Also, it is mentioned, especially by Avicenna, that this condition is also a form of obsessive, maybe psychotic disorder. Next, please. Yeah, other psychotic disorders, I would like just to mention just really two, which is one is called Junūn or Junūn Idbari, or then the one which is called Junūn Mutlaq or Mustawag. Next, please. Interestingly, Junūn Idbari could be translated into English as a cycloid, as I said before, insanity. However, it is defined as a form of chronic, long-standing psychosis, which is believed to be exacerbating mostly during the spring, but during the rest of the year is really in remission. For Razi talks about Junūn Dawri as a form of melancholia, seasonal affective disorder. However, for Avicenna, cycloid insanity or Junūn Dawri is a variant of mania, especially occurring in spring and summer. When we compare this with let's say, European literature, Pinel in 1798, he talks about la manie périodique or intermittent, so which in my opinion resembles Junūn Idvari. And Pinel defines this as a form of paroxysmal relapsing insanity with high degree of physical and mental energy, but without a lot of delusions. If you think about ICD, this condition could mimic bipolar affective disorder. Next, please. Back. Thank you. Junūn Mutbaq, or absolute insanity, is really interestingly defined as a complete insanity that totally covers the mind. It means it must be a very severe form of psychotic disorder. And the definition is that it should last at least 1 month, or the other very famous, let's say, judge, Abu Hanifa's discipline, talks about the condition to last at least 1 year. Interestingly, if you can look at the ICD-10, the diagnosis of schizophrenia, the requirement is that it should last at least 1 month. However, residual schizophrenia and simple schizophrenia at least for 1 year. Very interesting. Next one, please. If you look at really next, if you look at the one of the earliest classification of insanity by Hippocrates, the father of medicine, who divides mental disorders into 4 categories: mania, melancholia, paranoia, and phrenesis. Next, please. It's really important to say that from Greek antiquity until 16th, 17th century, there's nothing new in European really medicine. Next. Until 16th century, when Robert Burton is talking about in Anatomy of Melancholy, talks about melancholy only. And he's talking about melancholy, but as a form of madness with different really phases, including head melancholy, bodily melancholy, windy melancholy, and so on. Interestingly, that he is also using language like love melancholy and lycanthropy and religious melancholy under the head melancholy, for example. Next. And also, very interestingly, the famous Philippe Pinel, he is talking about also only 4 forms of mental disorders in his classification. He talks about melancholy, mania, dementia, and idiotism, which is a mental disorder, so mental retardation or learning disability. And dementia, we talked of dementia. He doesn't talk of dementia like dementia, what we understand today, but he was talking about schizophrenia as a form of dementia. In mania, he talks about 2 forms of it. Mania with delusions, which is mania psychotic and not psychotic mania. Next one. And a famous German Kraepelin, Emil Kraepelin, the father of DSM, some called him, he talks about only 5 forms of mental disorders, including dementia precox, which is schizophrenia, manodepressive insanity, paranoia, depression. He is for the first time speaks about depression instead of melancholia, and psychogenic depression. Next, please. If you look at the history of madness in the course of history, as you can see, Greek physicians or Greek medicine talks about only mania, melancholia, and paranoia. In the 18th century, the term of mania, especially as a synonym for madness, was replaced by Callan, Scottish physician, to neurosis, suggesting that there was really a form of false judgment generating disproportionate emotions, of course. The term from mania going to neurosis, from neurosis then in the 19th century, Constant talks about psychosis instead of neurosis, and Slevin and 1845 talks about psychosis as a form of psychopathy that is changing the entire personality of a person affected by his condition. And of course, later, under the German physician Mobius, in the late 19th century, talks about endogenous psychosis and exogenous, of course, any reactive conditions. And of course, we know that Morel and later Sigmund Freud changes neurosis to in the context of what we know today, and so on. Next, please. If you look at the international classification of diseases, if I may say, it's really quite surprising that the first in the classification of international list of cause of death in 1893 does not mention at all mental disorders. Only in 1938, the first revision conference of international list of cause of death, which is really ICD, let's say, International Classification of Disease, talks about 4 forms of mental disorders: mental retardation, as a learning disability, schizophrenia, manic depressive psychosis, and other mental disorders. Next, please. When now, again, we can come back to Arabic-Islamic classification, we can see that they had a very sophisticated classification of mental disorders. They divided mental disorders into symptomatic, permanent, reactive, and others. So I think if you again compare it with even most recent ICD, it is really quite similar to current classifications, and in my opinion, really amazing, I have to say, to see that this was almost 1 millennia ago. Next, please. So to conclude, I think it's really important to say that the Arabic or Islamic classification of psychosis is really a milestone in the history of psychiatry, and underscores the importance of cultural diversity in forming and conceptualization of psychiatric knowledge. Of course, Junūn or psychosis is divided mainly into symptomatic and organic, let's say, mental disorders. So Junūn, as in science, is considered as a primary brain pathology. That's really amazing. They felt, if you look at the old books, on those Arabic and Islamic books, mental disorders always under the category of diseases of head. So they are not talking about mental disorders we say today, but they always link it to illness of head. Really a concept that was really reinvented later by Griesinger, known as the organic model of mental disorders. It's really important to say that these Arabic textbooks of the famous physicians have been translated into European languages, mainly to Latin, which was the main language of science until the 19th century. And most, in my personal opinion, most physicians of the time were familiar with these textbooks. And some might not agree with me. In my opinion, they must have been influenced by Razi, by Avicenna, Majusi, and those Arabic Islamic famous physicians. So that is the end of my presentation. I'm really grateful for the opportunity, and thank you so much.